Okay, let's talk a little bit about implants. And, there's lots of talk about 24-hour implants and this and that. Give us a little rundown of what you do in your practice and, what options exist for patients.
Sure. In regards to implants, I would say right now, it's the rage in dentistry. It's the gold standard. You lose a tooth, or you're going to lose a tooth, and we're able to replace that missing tooth or the lost tooth with an implant. And instead of grinding the teeth right next to it, which a lot of people don't like, to place a bridge or to place something that's removable, they were able to replace one, two, or several teeth with implants, and they are very convenient. The expectation is that they will last as long as regular teeth. Each case is different, but I would say that the nice thing about implants is it's the closest thing you can get to recovering the lost tooth that you lost. I don't know if that kind of is redundant a little bit, but I always tell people that.
That's good. That's good. It's replacing the lost tooth that you lost, because sometimes we're not aware that we lost something. I can get it. So, and what about this? Like, for instance, because normally an implant, it does take about 4, 5, 6 months. Basically, the metal, thing which gets
the
real implant. It needs to settle, it needs to grow in. But then there's all this talk about these implants which can be done literally the same day, kind of, or whatever.
I have to be honest with you. I've been placing implants for a while, and one of the things that I can say is that each case is different. Most of the time, I don't like to make false promises, or not false promises, but kind of raise a patient's expectations or hope. The reality is that the implants need to be placed in healthy bone. The healthy bone needs to heal or accept the implant. There has to be a healing process, which is very similar to any other part of our body. Sometimes we can do certain things that can place a temporary or a partial tooth on there so a person doesn't have a gap or doesn't have a missing area for a special event. But there are certain circumstances where we can place an implant on the day that we're removing a tooth, but they have to be very specific conditions. Each patient's situation is different. I always like to be very honest with people and explain to them that the healing process can take anywhere to 3 to 4 months, or it can take a little bit longer. Ultimately, to those who wait, the prize is a very good prize, because they will have a nice stable tooth and they will recover what they lost.
Beautiful. So it takes what it takes, and and there's no reason to hurry it. However, there are some people who qualify for an implant, which then actually goes pretty fast, and it's all done and over with.
Yes.
Yeah. And of course, in the end, like, it may or may not be that important. Because if today somebody has a problem in his mouth, he has a missing tooth, chipped it out or something, and he has a wedding to go, then you guys can always make a very short, temporary, make this thing looking beautiful for a week, and then engage in the real treatment, right?
Yeah, there's ways of making sure that that the patient is very comfortable, that those type of unique situations or those common aesthetic requirements are met. There are many different solutions that can accompany an implant. The main thing is to make sure that during the whole process that it's a very honest assessment of each individual patient's situation. Some cases lend themselves to that. I've seen those situations where 24-hour implants, and while it does apply to certain people, it does not apply overall to most of the population. It's very specific cases. So I want to make sure that yes.
You will let him know.
Yes, exactly.
Will let the patient know. Knowledge exists. Everybody, not everybody, but you do know about it, and you should know about it. And just like, trust your dentist a little bit. He'll tell you what's right.
Yes.
Beautiful. Very beautiful. Thank you very much.
You're welcome.